Well, you heard it there. Obviously, congressional Democrats are not happy with the Senate's new health care bill, with some even going so far as to say it will cost lives. Let's bring in Congressman Robert Pittenger, the Republican from North Carolina, and a guest on this broadcast before. Welcome back, sir. Good to see you.
Good to see you, Alex. Happy Saturday.
Oh, thank you. Let's get to a lot of things there that we have to react to. The first one for now, how do you respond to Senator Warren's claim that the cuts outlined in this bill, rather, are blood money?
Well, that sounds like something that Senator Warren would say. I think the reality is that what we have in Obamacare today doesn't provide health care. You look at the market. You have United, Humana, Aetna, Anthem pulling out of the market. In North Carolina, we have Blue Cross Blue Shield. They've threatened to pull out. They've already pulled out in several other states. As well as the premiums in North Carolina have gone up 176% just since 2013. Nationwide, that amount is 105%. So reality is, American people don't have health care. It reminds me of that song by Johnny Lee, the country western song, Looking for Love in All the Wrong Places. There is no love found in Obamacare for the American people.
All right. Well, two points, sir. First of all, Senator Ted Cruz says that even this bill is not going to cut premiums. And secondly, you say you list these insurance companies that are leaving states. Do you expect then, with the passage of this Senate bill, that ultimately all of those insurance companies would return?
Yes, ma'am. I do believe that the market will open up, and I think that we'll have access for the American people. Remember, this is not going to be a federally mandated program. The American people are going to be able to buy the kind of health insurance that they want to buy and not be forced to purchase something that they don't want to buy. So you'll have plans catered to the American people to the extent of what they want to really acquire. And also, it's going to be mandated back to the states, allow the states to direct this. Nothing that the federal government ever does is managed well. You can look at the VA, the post office, so many things we have real struggles with. We have passed a bill this week to reform the VA, to create accountability. And yet what we're going to do now is take this back to the states and have real accountability.
But sir, what about those states that are already financially drowning with what they pay for health care, and they really rely on federal money to help support them?
Well, there's going to be tax credits in this bill. There's going to be the ability, particularly in Medicaid. I've worked on Medicaid now for 15 years, Medicaid fraud. It is pervasive throughout the system. In North Carolina, we brought in some major efforts, software, to look at those who are exploiting the system. The problem, that the structure, the way it's set up, is the federal government funds all the Medicaid, and the states determine who's eligible. They have no incentive to see who is really should be receiving Medicaid. If we take all this back to the states, they're going to have the ability to prioritize that funding and, frankly, to put in accountability procedures that will allow them to reel out those people who are exploiting the system.
But, sir, I know you talk often about Medicaid fraud, and the reality is that Medicaid fraud, as analyzed by the American Medical Association, amounts to about 3 to 10% a year. But there are all sorts of judgments, sir, as you know, where that money is returned. I can look at 2015. According to the FBI, the government recovered $2.4 billion in fraud judgments. Since 1997, according to the FBI, the government has returned over $29 billion in false judgments. So what
I've seen reports, Alex, in all due respect, that there's fraud, and this is from providers. In North Carolina, we have 60,000 providers, and they know how to exploit the system. But there's software that will enable you to go in there and look for improprieties, look for people who are going into the system, and they're in a position to exploit it. So we have here in North Carolina, there's about $400 million of savings that can be achieved through Medicaid fraud. So this 2 or 3% number is really not a factual number. I've had many reports written by CPA firms, national firms, that show that it's closer to 15 or 20%.
What about the new poll, if you want to talk about those numbers, in which there only 20% of Americans support the health care bill that was passed in your chamber, and even for Republicans, that number is still under 50%. How do you move forward with an agenda that even Republican voters don't appear to support?
There's a lot of confusion out there. I do respect and understand the questions people have because, frankly, they don't know what reality is. They do know reality, though, currently of Obamacare, and it is failing. So if you look at the presupposition that Obamacare is failing and we have to come in and we have to rescue it, that's what we're trying to do right now. The public doesn't have a clear understanding of all the nuances of our bill. With either the House bill or the Senate bill, but they will. It's going to be a market-driven bill. It's going to be one that will provide real access. You know, if you're somebody making $50,000 or $60,000 a year, and your deductible is $5,000 to $10,000, and you're paying $1,000 a month in health care, you don't have coverage, much less those who don't have the access to it in their own market. The New York Times came up with a recent report that there's 45 counties in the country next year already that they know that will not have any coverage whatsoever. In North Carolina, 95 of our 100 counties is covered by one provider, and they've threatened to leave the market. And
in terms of your own state, I know nearly 20% of the entire population is covered there by Medicaid or CHIP. But, sir, I do want to talk about the president, who back when he was still just a candidate, he made a lot of promises about Medicare and Medicaid. In fact, let's take a listen to some of them.
Save Medicare, Medicaid, and Social Security without cuts. Have to do it.
I am going to take care of everybody. I don't care if it costs me votes or not. Everybody's going to be taken care of much better than they're taken care of now.
You'll have great health care at a fraction of the cost, and it'll be great.
I'm not going to cut Social Security like every other Republican, and I'm not going to cut Medicare or Medicaid.
What happened to these promises, and what about the people who voted for the president based on those promises?
Well, I think reality, again, you take Medicaid back, Alex, to the states, you're going to have accountability in the structure. When the states are able to spend liberally and put anybody on the rolls in terms of eligibility, but have zero accountability when the federal government is paying the larger amount of the bill, that's not a good process. And what we're going to provide now is for the states to be incentivized to best utilize these grants to go back to them. So I think the real people who have real needs, I mean, we're a country who cares deeply about people who are struggling. We want to be a safety net for those who really have a need, but we don't want to be exploited. And I think that's really the bottom line of what the president's trying to say, is for those who really have a need in this country, we're going to be there for you.
All right,
but for reality, for those who are exploiting the system, and there are lots of folks doing it, we're going to take care of that.
I want to pick up on that for people who really have a need, sir, because last month you said that people should move to a different state if they have pre-existing conditions and they can't afford the health insurance in their own states. Now, in retrospect, sir, do you think that's an unrealistic option, particularly for people who have, say, cancer and they have no income because they can't work?
Well, let's pull it into context, and I appreciate you bringing it up. Alex, the reality is if we have a federally mandated program, it is a failing program. And I think any thoughtful person who's being honest and doesn't have their head in the sand realizes that the current structure is not working. What we propose is to take this back to the states. There will be options that states have. They're going to manage their health care. It is very unlikely that somebody's ever going to have to move, but that would be a worst-case scenario. You know, we move because of tax reasons. We go to other states, or educational reasons. There are many reasons why people move and want to locate to a state. So that's not unusual for that to happen. But frankly, it's going to be very unlikely, because I think what you're going to find out is there's ample funds put in there, particularly for those with pre-existing conditions. Our bill fully funds pre-existing conditions, and the Senate bill will as well. So that's the major concern that people have in the market, and that will be funded back in their states. It is so unlikely, but a worst-case scenario was my point, and I don't think that that's ever really going to be a meaningful factor.
All right, well, Republican of North Carolina, Congressman Robert Pittenger, thank you very much for your time, for taking the questions and answering them. I appreciate it. Thank you. The voice